problem. Professor, thank you so much for joining us. I would imagine that this must be, these alcohol bans, and we've had a number of them, it must be fascinating on one level to see what is essentially a real-life experiment being conducted.
Certainly, and you know, we're the only country in the world to have had 3 alcohol sales bans. So there is a lot we can learn. We can learn about the effects of going from no ban to a full ban, and we can also learn from going from a full ban to only a ban on consumption sales. So I think there are some lessons we can learn, particularly when we look at the very good data set that the Western Cape, that exists in the Western Cape Sentinel trauma surveillance system.
Well, I mean, it seems to suggest when we see how...
So if you like, I can... Yeah.
Yes, sorry, I was just going to say, it all seems to suggest that it works. Sorry, we had a slight cut out there. Yes.
Yes, certainly. You know, when we look at the 2 weeks before the 29th of December last year and the 2 weeks into 2021, we can see across the 5 hospitals a 51% reduction in trauma from before, in the 2 weeks before to the 2 weeks after. So it certainly did free up hospital capacity. But we can also learn from, there are calls, as you said, from various players in the liquor industry to get the government to reallow at least off-consumption sales to keep some parts of the business going. But we can also learn from what happened in May and June, which is when they almost did exactly that experiment. In May, we had a complete ban on liquor sales on and off-premise consumption. And then on the 1st of June, we opened it up and said that any outlet can sell for off-consumption only. And what we find in the 4 weeks from May, comparing it to the 4 weeks in June in the Western Cape, was a 49% increase in trauma admissions from the lockdown level of trauma to afterwards. So we can probably expect something similar. In fact, the Western Cape is fairly conservative. So the changes are likely to be slightly higher for the rest of the country. So we can probably predict that if tomorrow the government was to say we'll allow only off-consumption sales, that the current levels of trauma would increase by about 50%. And the question, I think, facing the government is, can the hospitals survive with that additional burden of trauma? It's obviously from the level of trauma that's now after the liquor sales has been banned, can we allow that level to increase by 50% and still have enough capacity in ICUs, in ventilators, and can our hospital staff cope with some more patients? And certainly the information I'm getting from places like, I was reading something about Steve Biko Hospital under a lot of pressure in Pretoria, situation in Limpopo, and I'm not sure that they can absorb that extra 50% increase.
I mean, this is the tragic reality, is that there are so many people reliant on the income that is provided by the alcohol industry, and those people are getting increasingly desperate. The restaurant industry is also saying, please just allow us something. And it's heartbreaking all round. But as you say, at the end of the day, our hospitals, private and public, are in a severely difficult situation. But how much longer can an alcohol ban continue? Let's set aside the fact that it's having a dire economic impact. Let's just look at this economic, rather the ban of alcohol. We cannot continue it indefinite, because surely what will happen is an illegal industry will spring up and take the place of the legal industry that is now being banned, as we saw with tobacco.
Yes, it's a little bit harder for alcohol because it's easier to smuggle cigarettes. Alcohol, certainly you can't transport beer in huge quantities across borders. It's much more difficult. But obviously over time we can learn from prohibition in the States. It's not a long-term solution. And certainly people are homebrewing. There's been a few deaths from methanol poisoning. But homebrewing can never compete with the huge industrial machinery that's pumping out tens of thousands of liters of beer every day. But I mean, eventually, yes, the illegal sales would increase. But we need to remember that much of the selling of alcohol is illegal in South Africa anyway. Perhaps as much as 70% is sold through unlicensed outlets. So we already have a large illegal sector. But it's not to say that we have no sympathy with people in restaurants. We need to find a solution in the long term so that we don't ever have to have these liquor sales bans. I mean, it's a fairly blunt tool, but it's very effective in the situation. And we need to deal with things that the government hasn't done right, things the liquor industry is getting away with, and really tighten up the situation so that there's a much more normalized situation, less people drinking heavily, and restaurants can trade. And perhaps we do have too many people in the liquor trade, but that's going to take a lot longer to solve.
Yeah, because, on the one hand, liquor production creates jobs, and we desperately need jobs. On the other hand, alcohol abuse, and we have got a massive alcohol abuse problem, as these bans have shown us, it destroys lives. So do you think that government should be perhaps paring down or discouraging any new investment or trade in alcohol production? Is it a time to look at our alcohol policy?
Certainly we need to do that. I mean, there's certain parts of the industry that I think are more problematic than others. I mean, I think the very cheap wine, bag-in-a-box wine, the Roy Proppies, which is the cheap wine or ales in plastic bottles with red tops, that's a part of the business we don't need. And I think these ever larger containers of beer, which are also, they're not resealable, and the price is very low. So I think we need to deal with that problem. And we need to keep the parts that are less problematic, the craft beers, as you talked about the restaurant business, that's probably not adding as much to the burden as some other parts of the trade. But I think we're not seeing the government, even during the last 6 months, really doing anything different about alcohol. We really need to move ahead with the 2017 Liquor Amendment Bill, which is now 4 or 5 years late. Nothing's happened with that. And really try to get a more orderly liquor sector, control marketing, deal perhaps with cheap pricing. Many countries are looking at minimum unit pricing, which means that you can't sell alcohol, say, for below R5 standard unit. And I think things like QR codes on containers so we can see where illegal trade is coming from. Russia had huge problems in the early, I think it was the early 1990s, 80s, and it turned it around by a whole basket of measures, not banning, but dealing with controls on marketing, controls on late-night sales in certain areas, illegal selling through scanning of containers, and pricing, and things like that. So I think there's a lot more we could do so we never have to have this sort of liquor sales bans which we've had in this country.
Yeah, you're quite right. And I think that so much that researchers like yourself are learning about not only the extent of the problem, which I'm sure you've always been aware of, but what needs to be done going forward. But in the short term, looking at this ban, you have explained that it's all about how our hospitals are coping. But you've got that look at the whole sector. How long do you think alcohol should continue to be banned for? What is your best estimation? Are we looking at a couple more weeks, do you think? Maybe a couple of months?
No, I would say between 2 and 4 weeks. Certainly in the Western Cape, probably within a couple of weeks, we've reached the plateau. The hospitals will have capacity, but it might take a couple more weeks beyond that for other parts of the country. So I really think that perhaps 4 weeks. They've talked about the 16th of February. I think that's probably the time period where we need to start planning for lifting the ban on that date. It shouldn't continue for forever, but we need to bring perhaps other measures in place to perhaps prevent the chaos that we had on the 1st of June when we moved to an off-consumption sales only. It didn't work very well. So after 6 weeks, there was a revision of that. Didn't work. So let's try and do better than we did on the 1st of June.
Yeah, you make such a good point. This is not our first rodeo when it comes to this alcohol ban and reintroducing alcohol, and we need to get it right this time. Thank you so much. I really do appreciate your time. That was Professor Charles Parry, Director of Alcohol, Tobacco and Other Drug Research Unit at the SA Medical Research Council.